What does PPN mean and why is it so important?
It allows us to have partnerships with other children's hospitals.
I would argue you guys probably have the best practice in that space.
We were able to use PPN resources to launch a lot of our mental health work in the community.
I think what ChildrensMercy has really brought to the table as the expert for our network is disaster management. What did you guys do? How can we learn from you? One of the things that we are learning most in the pandemic network is the importance of community engagement. Kids are 20% of the population and 100% of our future, so this is so important.
Hello, everyone. I'm Jodi Coombs, the Executive Vice President and Chief Operating Officer at ChildrensMercy. I have a special opportunity to introduce Dr. Joelle Simpson, who is visiting from Washington, D.C. Dr. Simpson is the Chief Emergency Medicine and Medical Director of Emergency Preparedness at Children's National. We also have our very own Dr. Jennifer Watts, who is the Chief Emergency Management Medical Officer and Patient Progression Officer. Dr. Watts and Dr. Simpson have dedicated their careers to pediatric emergency medicine, and we are here to discuss an important role that they play within the Pediatric Pandemic Network, otherwise known as PPN. Thank you both for being here this afternoon. Dr. Watts, in your own words, what does PPN mean and why is it so important?
Yeah, PPN is the Pediatric Pandemic Network. It's a network that consists of 10 hospitals, 10 children's hospitals across the country, where we all come together, we collaborate, we share best practices, we develop new innovation, new ideas, and innovate on ways to take care of kids during disasters. We work on preparedness factors, we work on response in disasters, and we ensure that all kids have access to high-quality, equitable care before disasters and at the time of disasters. And so it's all 10 of our hospitals figuring out what works best, networking that out across our catchment areas. So eventually we have all of these areas as a country coming together.
That's fantastic. Dr. Simpson, if you were able to zoom out, how would you describe the realm of the pediatric disaster preparedness and why the PPN was created?
Well, a lot of what the Pediatric Pandemic Network does is building on some informal networks that we had before. I would call Dr. Watts from my shop at Washington, D.C. and ask, what did you guys do? How can we learn from you? And now we have some formalities sponsored by the Health Resources Services Administration that manages our grant among the 10 hospitals so that we can learn from each other in a more formal way and bring in so many partners that we need to, like our school systems, our health departments. So it's been a nice opportunity to sort of see where we can grow from there in a way that can be shared with not just children's hospitals, but also with the rest of our health system, and it's much needed.
You're absolutely right. It truly is needed, and thank you for helping to lead that work because it is so critical. ChildrensMercy is one of the 10 Children's Hub sites. So Dr. Watts, tell us what it means for ChildrensMercy and how does it involve and impact kids here?
It helps on multiple levels. One, it allows us to have partnerships with other children's hospitals to share best practices and best ideas and allow us to collaborate together. So we're not reinventing the wheel and starting over from scratch. The other thing that it allows us to do is to bring all of those resources that we work on together as a group of 10 hospitals and bring them here to Kansas City and execute them for kids in our region. Things that we could have taken years for us to do here in the community, we've been able to move up and do faster. Critical at times, such as the Super Bowl parade shooting. When that occurred, that was a big event that impacted our city. And following the parade shooting, we were able to use PPN resources to launch a lot of our mental health work in the community in order to reach these kids and impact the trauma that these children faced. Not just the ones that were at the parade that witnessed it firsthand, but also all of the kids that watched it on TV, the kids that had family members present at the parade shooting too. And so we were able to bring all of those resources together, move them up, execute it in a very timely manner to make sure all kids had the resources they needed. If we were not part of PPN, I don't think we would have been doing the same things for our kids in our community as we were able to do. So that's an example of where we used it immediately. Other things where it impacts our kids and our families are the ongoing preparedness, the ongoing readiness for everyday disasters. Even a child going to the emergency department is an emergency, and it can be a disaster for that family. And so all of these resources also translate into everyday readiness and everyday preparedness.
That's so important to really tie that together about how coming together really does help us both locally and nationally. Dr. Simpson, how can we work together as children's hospitals to improve health outcomes and support the resiliency of children, families, and communities impacted in crisis?
Ooh, that's the million-dollar question. Thank goodness we have a couple $1 million that we've been funded with. And I'll say that we're learning from each other on how best to do that, what outcomes matter. One of the things that we are learning most in the pandemic network is the importance of community engagement, thinking about the issues of the inequities in pediatric care, and that mirror sometimes adult care, but have their own nuances. And some of the things I've even seen today at ChildrensMercy in terms of the importance of those healthcare deserts that we see across the states, and where can we as children's hospitals with all of our resources support children that are in those areas. The metrics that we use to measure outcomes in those spaces might be different than what I use in Washington, D.C. Yet still, when we come together as 10 hospitals and our partners, we're able to think through that together. And we've built a research infrastructure. We have pilot awards. We have a lot of smart people that care about kids that are coming together to answer that exact question. So that's my long-winded way of saying that the network is able to amplify all of the work we've wanted to do in our very tight bandwidth of work that we have to do as children's hospitals. But we're getting there. I feel much more reassured that in the next couple of years, we'll have some answers as to how to measure our success, essentially.
That's fantastic. Thank you. What can you share about the future of PPN and top areas of focus?
When you think about the questions we're trying to answer, they're really difficult. The pandemic put a spotlight on the needs that we have as children's hospitals and the needs of kids. Particularly in the Pediatric Pandemic Network, we have thought about what's at our doorstep now, the mental health crisis, so we put a lot of focus there. We mentioned community engagement and health equity. I think what ChildrensMercy has really brought to the table as the expert for our network is disaster management. What does that look like across children's hospitals? What is best practice? I would argue you guys probably have the best practice in that space. And then because of the pandemic, we've learned that infectious disease and the work we do in that space, the biological threats, are really one of the greatest downfall for our pediatric healthcare system. So we focus on those 4 areas: mental health, community engagement and health equity, infectious disease, and disaster management.
The other thing I think it does is brings awareness to kids. And we saw during COVID-19 how kids were kind of tucked under the table a little bit. We're a very vulnerable population that we didn't always have on the forefront of our minds because they weren't the ones impacted getting sick all the time, yet they were severely impacted, and we're seeing a lot of the fallout from that even to this day. There are so many hospitals and organizations in the community that don't even talk about kids when it comes to disaster planning. We are grateful if people talk about disaster planning at the forefront. We are even more grateful when they start to incorporate kids into the planning. And so the future of PPN also raises awareness around pediatrics and gets us to focus on kids and brings community organizations together to highlight the importance of why we're all here. It's what we do every day as children's hospitals. We wouldn't be here if we didn't believe in it. And so it's taking that vision and putting it out into the community. So the future of PPN will continue to drive that in whatever way, shape, or form that may look like, because our society continues to change, but the importance of pediatrics will always be there.
Thank you both for putting that on the forefront for our children and for our communities. It's so critical. Thank you, Dr. Watts and Dr. Simpson, for this wonderful conversation. And most importantly, thank you for your leadership. It's inspiring to see how this work really docks into communities to help them plan for emergencies or challenges that may arise in the future. So with our sincere appreciation, thank you for your tireless work and effort to help us in this journey.
Thank you, Jodi, and thank you for your ongoing support and allowing our organization to continue to be a part of the network and change the face of disasters.
Seriously, I echo that, and thank you. I heard a saying recently that kids are 20% of the population and 100% of our future. So this is so important, and so thank you for elevating the importance of our work.